Welcome back and happy Friday from the CRA. I'm Shannon from the Arthritis Patient Advisory Board, and with me I have Dr. Roberto Mendoza, who had just given a workshop presentation this morning on understanding the spectrum of joint hypermobility syndromes, Ehlers Danlos syndromes, and beyond. He is the Director of Pediatric EDS program at Sick Kids Hospital in Toronto, the Associate Professor of Paediatrics and Molecular Genetics at the University of Toronto and the Hospital for Sick Children, and the head of the Division of Medical Genetics and Genomics, and the co-director of the Center for Genetic Medicine.
Thank you very much.
You're busy.
I am.
Thank you for joining us.
Thank you very much for the invitation and the opportunity to talk to you.
Could you tell everybody what got you interested in rheumatology and specifically the hypermobility diseases, and then possibly why children?
Sure. So I come a little bit from a different background. I am not a rheumatologist myself. I'm a geneticist, and I trained first as a geneticist when I finished medical school, and then as a pediatrician, and did a further fellowship in genetics with emphasis in bone disorders. Bone has always been my interest, and through bone disorders, at the beginning I was doing a lot more concentrated on dwarfism, but I became involved in cases of children with rare genetic disorders that are associated with hypermobility, and little by little I moved more into the EDS field, where perhaps the genetic contribution is important, but is not necessarily as traditional Mendelian disorders in which one gene results in one disease. I think that in the hypermobile EDS, at least, there seems to be a contribution of different genetic factors and environmental or personal factors that contribute to that, and that brought me here.
Are we on the way to solving that mystery?
We are on the way, but solving mysteries for multi-genetic, like polygenic disorders or multifactorial disorders is much harder.
Yeah.
I think that there are certain families and certain individuals that have a presentation that is so unique that may bring a lot of clues. But the identification of the specific genetic basis for all patients with hypermobility is going to take a while.
Does that contribute to the challenge of receiving a diagnosis or obtaining a diagnosis?
Significantly,
Yeah.
because I think that clinical diagnoses are important. We have criteria by which we define who has a particular disorder, and those help us in two ways. They help us identify people that are at risk of certain complications and what we call comorbidities, which are the diseases that may present in somebody that has, for example, hypermobility. But the second thing that it allows is for patients to know, bring closure to perhaps an odyssey of many years of wondering what it is that they have that gives them the symptoms that they're presenting with.
What are the challenges with a delayed diagnosis?
It is a problem. It's a problem in terms of access to the adequate resources, preventative measures, and hopefully prevention of a more severe presentation, because the awareness of hypermobility type EDS has only come in the last perhaps 12 years or increased in the last 12 years. I think that we have an important segment of the adult population that was never diagnosed and that went from doctor to doctor to doctor trying to have an answer to their multiple symptoms and being very frustrated about both the lack of answer, the lack of plan for management, and a lot of uncertainty.
And taxing on the system, I would imagine, because they're not receiving, they're going from doctor to doctor to doctor, which costs, and then they're not getting the treatment, which could later cost with the complications from the disease.
Right. So I think that the cost analysis is actually a great point that you bring up, and something that we have not included so much in our initiatives. We have been focused on finding the cause and finding how we can intervene. But certainly, when you have multiple complications and those complications are not managed in a holistic way, you end up draining more resources from the system than you should.
Right.
And there's a lot of awareness now in genetics in general about the cost analysis for all of these diagnoses.
I think it's a topic that patients are interested in because, genetics and genomics and all the science around that is not something that really gets knowledge translated to the general public or to patients in a fashion that they can understand, but something that I believe they're very interested in and knowing what's happening and what the research is.
So we strive to do as much knowledge translation as possible. Knowledge translation can be in the form of a more rapid diagnosis. So for the forms of EDS that are caused by one single genetic contribution, we can do testing, and we have gone through periods of time in which we were offering just one single gene testing at a time to our current understanding, which is to do a panel that includes the most common genes. And for patients that are negative in the panel, we have a research option, which is now we have the capacity to read the entire genome. So all the pieces of the genetic material that code and tell us how to grow and develop. The challenge interpreting those results is that we have a huge amount of information. It would be like getting the Encyclopedia Britannica, but piecemeal, with pieces all over the place and without us knowing how to interpret it. So yes, from the patient's perspective, there might be frustration about the rate at which those discoveries are being translated into an effective treatment plan. And that's why we have to work hand in hand. Research, looking for the cause, but also research in looking for the treatment based on clinical diagnosis and prevention of complications. Because the root cause is going to allow us to design a very precise treatment plan. But in the meantime, we can start with a general management plan.
Right. So what are you looking most forward to with your research and assistance for these patients over the next 5 to 10 years?
An improvement in the quality of life. I think that that is what really we need to deliver for the patients. From my perspective, of course, I would like to identify the genetic basis because I'm a geneticist, and I went into this because I wanted to find the reasons why we develop the way we develop, and finding why we develop abnormally sometimes gives us clues as to what the normal steps of development are. But more urgently, we need to make sure that our patients are taken care of and that their symptoms are ameliorated and treated appropriately.
So what are your thoughts about this year's meeting theme, Building Bridges theme?
I think that it's absolutely the cornerstone of the current practice. There used to be a time in which there were single experts that amassed a huge amount of information and big teams, but that didn't necessarily collaborate. That's no longer possible. There's too much information. Nobody can manage it all. And so you need to build bridges between all the different disciplines, and we need to approach this together. So I think our clinic is an example of that approach, where we have a nurse practitioner, pediatrician, geneticist, genetic counselor, psychologist, social work, and physiotherapist, all working together, and everybody bringing to the table their interest and their understanding of the condition, and then building bridges in international networks, so that we all find consensus on the best way to treat these patients.
Yes, maximizing effectiveness. Are you finding, and just a quick thought popped into my head, because the pediatric aspect of your work, and because children are becoming so literate and have so much access to information, we don't use encyclopedias anymore.
I know. Yes, my example is going to become obsolete very soon.
Are you finding that your patients, the pediatric patients, are becoming more knowledgeable or more interested as time goes by?
I think that the access to information is a double-edged sword.
Mm-hmm.
They are more knowledgeable, but they're not aware of the depth or lack of depth of their understanding. So there are circumstances in which information can empower you to make the right decision, but there are other circumstances in which only one-sided information can skew you towards or make you think that you know the answer to a particular question. And I think that what's fascinating and frustrating about science is that our questions have many different possible answers, and trying to grab entirely to one single point of view or one single answer can be actually deleterious.
Are they coming to you and having that conversation about things that they've read, so that they know that you know that what they're reading, and so that you can help put that in perspective for them?
Yes,
Yeah.
we are very open to put things in perspective, and I used to tell the parents a few years ago, try not to read Google, and try not. Now I say, I know you're going to read Google. Be aware that there's good information and not so good information. So learn to filter. I always give them a couple of resources and a couple of websites where they can go.
Excellent, yes.
And for Ehlers Danlos in particular, I think that several organizations have worked towards putting information out there. The Ehlers Danlos Foundation in North America and around the world has a very good website that I hope that the link can be made available to the people watching this.
Oh, yes.
And it has a webinar about the classification of Ehlers Danlos. It has a site for patients, a site for physicians. You can actually tell your physician, if they're not very familiar with the symptoms, to go there. It's a very understandable set of slides, and there's also the transcript of the discussion.
Is there cross-education? I'm thinking there might be some first-line caregivers that may see symptoms of Ehlers Danlos, like if somebody's going to a physiotherapist for a different reason, but they may be the first line of identifying that that's what may be going on.
Yes, I definitely primary care providers and other healthcare providers that are not physicians are sometimes the ones that make the connection or that help the patient make the connection. So activities like this one, and I was thinking after the workshop, I should go on a trip around Canada and give this workshop in at least once in each province, so that we start spreading the word and make all these resources available, so that there's more awareness of what the criteria are, and there's more possibility for patients to be directed in the right way.
Have you had the opportunity, or if you know there's been an opportunity to present to the AHPA
I'm sorry.
at the meeting, the allied health professionals that are at the meeting, for example, at the CRA? There's, nurses, OTs, PTs.
I am not aware. I don't know how the organizing committee.
Well, I suggest you get on the list for next year.
There you go. Yes, absolutely. I think
that would be a really, you want to shine the light on it, I think, because it is something that can be missed so easily.
Right.
Yeah.
Our team has been trying to reach out. So the nurse practitioner has reached out to the nursing group, and she has given talks. The pediatrician, the physical therapist, but of course, there's always more. What we want is for this to be an echo. We can give one, and then if somebody's interested, they can either invite us, or next time we can co-lead with them so that they can spread the word.
Well, I will let you know that I did test some physical therapy students when I was at their lab in January at UBC.
Okay.
To tell them, to give them a heads up that that's if they can see that what the hypermobility can be a sign of.
Absolutely.
And they were definitely unaware.
Okay.
So as a patient, I also can teach. I don't know a lot about everything. I'm learning about other diseases aside from mine. But, sometimes just saying that one thing can pique the interest of somebody to go do some research about it.
I think that it's obviously, there's a constant dialogue, and I think that the same way that patients can learn from healthcare practitioners always learn from the patients, and the best sign of a good health practitioner is somebody that is open to that learning. I think the tone in which is given is important, because sometimes patients can be very dogmatic, and that's where I was coming from in the different perspectives. And so I think that bringing it up as a possibility and being open to the other person's interpretation is always good. But for sure, patients are their best advocates.
Yes, and I think that will be our closing note. Yes, you are your best advocate. Only you are the expert of your own disease and your body.
Absolutely.
So thank you so much.
Thank you very much for having me.
Contributions here today. It was so great to meet you.
Looking forward, and if anybody out there wants to reach out to me, I can be found with my complicated last name, which is hyphenated, Mendoza Londono. I am the only Mendoza Londono at Sick Kids, and I'm happy to give my perspective.
Wonderful. Thank you so much.
And lastly, there's one question. Do you have any tips for people living with EDS?
Oh, so many tips. Where do I start? I think that having a good daily routine, having an identified exercise set that builds on the strengths that they have and that does not lead to further tissue damage. If somebody is young and still has quite a lot of flexibility and not as much pain, don't overextend your joints excessively. Try to look for stabilizing. Don't rely too much on external fixations like braces, because your joints will lose the capacity to do it by themselves. So there's a role for both. Pair up with a good physical therapist, keep a good nutrition, a good exercise regime, and know that there are many unknowns. So partner with a healthcare provider team that can help you get the best quality of life.
Great.
Thanks
Thank you.
again.
Thank you very much.